Dry needling. What is it and why do we use it? Well, dry needling is used by a range of therapists, so you may have seen it at your physiotherapist, an osteopath or a medial massage therapist. However, not everybody is trained in dry needling. It is actually an extra course that most therapists have to do on top of their training that they've already received to become that therapist. It's quite a long piece of training because, as you can imagine, you're putting needles into people, but it's not as scary as it sounds. So let's have a look at dry needling, what it is and why we use it. So dry needling uses a thin stainless steel needle. So I actually have one here, let's have a look. So this is a small needle. It's one that we use for the face and head, so you can just see there, it's the needle itself is actually very small. We do have other needles that are slightly longer and the width is a little bit different in the metal depending on which muscle we're going to trigger, but generally it is quite a small needle. It's very different to the needles you'll be used to and commonly fear from going to the doctors. So it's nothing like wet needling, which is where the name comes from. So dry needling is called dry needling because no fluids are used, and you're more familiar with wet needling where perhaps you're taking blood or you're injecting fluids into the body. So what's the difference between dry needling and acupuncture? Well, they're very different actually. The needles are the same or similar, but the actual process is completely different. So dry needling goes into the muscles that the therapist wants to target, whereas acupuncture is a completely different philosophy and takes another 4 years of training. It's all about meridian lines, it's Eastern medicine philosophy, so I actually don't know about acupuncture, but I am aware that you will place a needle not at the site of injury but through the channel of energy, and you help get rid of pain that way. Dry needling, the therapist chooses the muscle where it has the trigger point and it goes after that trigger point, so it's straight on the source. They're very different philosophies, just similar needles. To understand how dry needling works, we really need to know and how a muscle works and also what a trigger point is. So I'm sure most of you are quite aware what a trigger point feels like. It is that tight bit in a muscle. It feels like a big knot, you press on it and it can be really painful, and it can also send pain signals elsewhere in the body. Quite often if you've had a massage therapist may really get on that point and press on it until the pain goes. So let's talk about how a muscle works and how a trigger point is formed, and then how dry needling can come in and make a difference. So, how does a muscle work? Well, we start with the brain. We ask the brain to send a message down to this particular muscle to fire it and get it moving and do the job we want it to do. So the brain sends an impulse down a nerve and it reaches a junction. So we have the end of the nerve and what we call a synaptic cleft to the other side, and this is a gap, and we need to get the nerve signal over to the other side. So to do this we have a chemical come in called acetylcholine, and that comes in and allows the message to jump to the other side. So we have this gap so that messages just don't always get sent and we're at a chronic state of tension, or that we just are firing muscle signals everywhere. So acetylcholine comes in, sends the message across, start an action potential, which then creates a chain reaction, which we'll go into in a moment. But as soon as that message is sent to the other side, we have another chemical come in called acetylcholine trees, which comes in and destroys the acetylcholine, so the message is stopped. So once this message is stopped, we then talk about the rest of the action here. So the action is jumped over to the other side, it's now called an action potential, and we start releasing calcium ions that travel down the canal of a cell that goes into a muscle body. When it reaches the muscle body, the calcium ions change the structure of the cell, and we allow then two proteins to bind together. These proteins are called actin and myosin. And so they create a little pathway that allow them to twist and rotate into each other. They then pull, and that's how the muscle is moved. So it's two proteins binding together, pulling and moving themselves along. It's called sliding filament theory, if you'd like to know more. So now hopefully you've got all that down pat. Let's talk about how a choke point is formed. So the thought is that when the acetylcholine comes in and sends the message to the other side, the acetylcholine trees doesn't come in and break down the acetylcholine, so the message just keeps on getting sent, and we just have this overload of messaging into the muscle cell, download the calcium ions, changing the structure, and it just doesn't stop, it keeps going. And that's what we believe forms a trigger point and why it can be so tender and feel quite dense. Now, how does dry needling work with all this? Well, the theory with dry needling that I adhere to, I believe makes the most sense, is that it causes a small amount of inflammation by going into the skin, penetrating the skin and penetrating the muscle body. So that damage sends signals to the brain to repair, and then inflammation is the start of the repair process. So cells come in and they check out what's going on at the site, they clean everything up, they'll break down the acetylcholine and stop the signal being sent and start everything else off back to where it should be. So that sounds great. It's quite often the effects of dry needling may not be immediate. Same with massage, is because we really need to let the body come in and do its own work. We are sending the signals to the body to come in and do the repair. It's how dry needling works. It's pretty much also how massage works, in my opinion. So is it for you? It could be. It's not for everybody. Some people don't like it at all, they find it quite uncomfortable, or it doesn't work for them. Some people just hate the idea of needles altogether. That's completely your prerogative. I quite like it in certain places. I feel like I get a lot of benefit when I get dry needling in the hips when I have a problem going on. I used to get a lot of benefit in my calves, but not so much, but that's probably because they're not as problematic anymore, fingers crossed. But I would always recommend it as part of a treatment. It's never really a treatment on its own. It's a tool in a therapist's repertoire that they can use to help release areas they think are going to be better served by dry needling than manual therapy, and different modalities that you can choose from. It's a great repertoire to have. So if you do think it's for you, please feel free to come and have a chat. So if you want to talk to me a bit more about how muscles work and how dry needling works, I'm happy to speak to you. Come and see us at Muscle Medicine, where send us a message. We're great to have a chat. We love to get into the science of things, and we're interested to hear your stories. If you've experienced dry needling, if it works for you, if you prefer not, great, come and see us, see what we can do for you.
If you enjoyed this video, please comment, like or share. Muscle Medicine Bodywork. Live your best life.